Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our session on basic emergency care course. This session is about altered mental status, and here we are going to discuss secondary survey and examination. We discussed the sample history in the previous session. The objective we mentioned to perform secondary survey by sample history and secondary exam to recognize key findings suggestive of different causes of altered mental status, list high risk causes of altered mental status, describe critical action to manage patient with altered mental status, and then you need to assess the ability to manage this patient in your facility or to transfer somewhere else. Possible causes are hypoglycemia. It can happen in the context of diabetes, severe infection and illness like severe sepsis, and also prolonged starvation. You get symptoms of sympathetic surge, symptom and sign of sympathetic surge, increase tachycardia, tachypnea, sweating, and feeling hungry, and then a patient can go to irritability, confusion, and sometimes they go to coma, and some of them might develop seizure. Blood glucose is low, it could be less than 3.5 millimole, and the good thing, it can respond quickly. Whenever you suspect that, you need to give glucose load. If the patient can take orally, you do that. Otherwise, you need to go through the IV. Dehydration, as it causes shock, it can lead to altered mental status. It happens in a context of fluid loss or poor oral intake. Patient can present with vomiting, diarrhea, and increased loss in urine as in DKA or use of diuretics. Then, as they progress into hypoperfusion and shock, they get irritability, confusion, and altered mental status. You can find tachycardia, tachypnea, reduce skin trigger, and dry mucous membrane, plus low blood pressure. Hypoxia. Always I would like to think about altered mental state in terms of AB as hypoxia, C as reduced perfusion, D disability, hypoglycemia. In hypoxia, you can see illnesses affecting the respiratory or cardiovascular system and sometimes severe sepsis. Patient present with shortness of breath and tachypnea, and in case of shock, they get low blood pressure, and they get low saturation, low oxygen saturation, and use of accessory muscle, and cyanosis is a late finding. Heat stroke, when it is prolonged heat, there is prolonged heat or sun exposure, then the body temperature will rise and the patient have very warm skin, and he might be sweaty or not. Sepsis and cerebral malaria are very well known causes of altered mental status. Can be, you can see fever, neck stiffness. In meningococcal, you can see skin rash, photophobia, headache, and it can happen during an epidemic of meningitis. Also, patient could have HIV or TB. Malaria, it happens in endemic area of malaria or some people who travel from endemic area. Here it happened because of release of cytokine and leucid cytokine, plus sometimes related to hypoperfusion as in septic shock. So as mentioned, in severe infection, you can get fever, tachycardia, tachypnea, hypotension might happen. You get sign of skin infection. You can get sign of lung infection by cough and crackle, and urinary symptom like dysuria. In some areas with rabies, you can get agitation, fear of drinking water, hydrophobia, drooling, weakness, and patient might have history of animal bite. Diabetic ketoacidosis is, in severe cases, you get altered mental status because of hypoperfusion or because of acidosis or because of the concomitant infection. History of diabetes, rapid deep breathing, cosmal breathing. They have polyuria, polydipsia, sweet smelling breath, and you get high blood glucose and feature of dehydration, tachypnea, tachycardia, low blood pressure, and skin dry mucous membrane, and reduced skin trigger. Toxic causes of altered mental status, alcohol or drug intoxication, or alcohol withdrawal or drug withdrawal. Patient could be non-alcoholic or drug user. You can see injection mark of drug injection. Alcohol acute intoxication or withdrawal can precipitate altered mental status. Those with chronic alcohol use can have cirrhosis and hepatic encephalopathy. Opioid during acute intoxication, they can get lethargy, constricted pupil, and slow breathing, bradypnea. In withdrawal, they get agitation, sweating, and diarrhea and vomiting. In poisoning, you can get history of exposure. It could be by inhalation, by skin, and even sometimes by oral intake. Patient can have diarrhea, vomiting, diaphoresis, and very small pupils. These are suggestive of exposure, especially those who are in agricultural work. Snake bite. You can patient have a history of snake bite. You can see bite mark with venomous snake, leg edema, blistering of the skin, bruises, hypotension, paralysis, seizure, bleeding from the wound, and even they can go to DIC. Toxic causes of altered mental status, medication, when patient get new medication or medication overdose. Gas poisoning, it can happen because of history of exposure, and it can affect many people, as in as in the industrial accident, patient can have headache. Seizure, patient might be known to have convulsion or seizure disorder. You can see, you can get a report from a witness or a family member that about the convulsive movement. Patient could bite his tongue. There could be urinary or bowel incontinence. Usually they improve gradually over a minute and hour. In pregnancy, when they get this, consider eclampsia. Patient could have feature of increased intracranial pressure because of tumor, because of trauma, because of stroke, headache. They can get vomiting, nausea, unequal pupil because of raised intracranial pressure and palsy of the sixth nerve, and they can get weakness in one side of the body and speech problem. Some metabolic causes like liver encephalopathy, patient could have history of liver disease, hepatitis B, C, or alcohol liver disease, or other causes. They can have jaundice, spider nevi, and shrunken liver ascites, and hypoglycemia. And source of infection could be there also. In kidney, is a patient with kidney disease, high blood pressure, edema, and swelling of the leg, decreased urine output. Sometimes you can see also uremic froth. Trauma is very important cause of altered mental status. You can elicit history of trauma. Patient could have visual changes, loss of memory, vomiting, headache, scalp laceration, bruising in the head, uh, blood or clear fluid coming from the nose or from the ear if it is fracture base of the skull, and you can get weakness and sensory disturbance and convulsion and unequal pupils. When we get someone with altered mental status, whenever you suspect hypoxia, give oxygen. If patient is having shock, also give oxygen. Those with dehydration, give good fluid resuscitation. When you suspect hypoglycemia, give glucose load. In hyperglycemia, you need to give IV fluid and correct the metabolic deficit by electrolyte and give insulin. Those with sepsis, start antibiotic as early as possible. Again, it's the most likely cause. If you are suspecting malaria, you start anti-malaria and you assess for malaria by blood film and ICT. Uh, Try to reduce the temperature and cooling the patient. Those with hypothermia, remove wet clothes and take them away from this environment, and you dry them and cover them with blanket and give IV hydration. If you are suspecting bleeding or increased pressure in the brain, elevate the head of the bed and make sure if there is spinal trauma, you immobilize the cervical spine. Those with suspected opioid overdose, stop the exposure and then give them naloxone. Those with convulsion, treat with benzodiazepine. If it is due to hypoglycemia, you need to give glucose load, and you can put the patient in the recovery position if it is not related to trauma. In pregnant lady, consider eclampsia, and you can give magnesium sulfate, and you get obstetric consultation, monitor them for magnesium toxicity. If you are suspecting alcohol withdrawal, first check glucose, replace glucose, and give benzodiazepine. Suspected poisoning or envenomation, try to identify the poison. In snake bite, immobilize the leg and refer to center who can give antivenom. Rabies, usually there is no specific treatment. It is mainly symptomatic treatment. Unfortunately, it is usually fatal. If there is a exposure to pesticide, decontaminate the patient and protect the airway and give oxygen and IV fluid. An antidote if you know that. If in case of if the patient is agitated, protect the patient from harming himself and others. And also you have to maintain your safety and make sure there is an exit so that you can escape. And remove any potential weapon and safe object. Always call for help and get others to help and support you. Speak in a calm, soft, non-threatening language. Explain what is happening. Do not confront and don't judge the patient. Whenever you suspect hypoglycemia, treat that, monitor vital sign and treat abnormalities, and always arrange for transfer and psychiatric consultation. If the patient suspected to have trauma, make sure you immobilize the cervical spine, manage hypoxia, manage hypoperfusion, manage hypoglycemia, and check Glasgow Coma Scale and try to manage raised intracranial pressure. Management of active convulsion, always check the ABCDE, maintain airway patent, give oxygen as needed, especially if seizure is prolonged. Place the patient on their side in the recovery position, protect the patient from harm or further injury. When you suspect hypoglycemia, give glucose, and if also there is suspicion and you cannot check glucose, just give empirical glucose load. Benzodiazepine. In pregnant lady, use magnesium sulfate. If no response, give another dose of benzodiazepine up to 3 doses, and then you can use phenytoin. Or if the patient does not wake between seizure, consider life-threatening condition, arrange for, and then you need to assess if you can get an imaging, and this can be done in your facility or you have to transfer somewhere else. Always, after you do the ABCDE approach and after you are doing the secondary survey, you need to assess if you are capable to manage this patient in your facility, or you have to transfer him somewhere else. So disposition depend on the cause and depend on the resources. Causes that cannot rapidly corrected or may return need management in hospital. Monitor closely for airway problem. Consider handover and transfer for advanced airway management. Hypoglycemia. Consider the cause and potential for its development again. If opioid suspected, use naloxone. In alter mental so take home in alter mental status, start with ABCDE. Fix a life-threatening condition. In secondary survey, follow sample history and secondary exam to elicit high-risk situation. Always consider hypoxia, hypoperfusion, hypoglycemia. Do not overlook systemic causes of altered mental status related to heart disease, lung disease, liver disease, kidney disease, sepsis, and poisoning. Look for intracranial process like infection, meningitis, encephalitis, cerebrovascular accident, trauma, and tumor. And whenever you suspect trauma, immobilize the cervical spine. And in pregnant lady, consider eclampsia. And thank you.